Hello, welcome to Humane, the podcast where we explore the depths of holistic healing and wellness. I am Siddharth, and today we have Dr. Chetan Raj, an expert in homeopathy, with us. Hello, doctor.
Hello, sir.
So, tell us what exactly is homeopathy and what made you choose it?
So, what made me choose this is an interesting story. Because when we were kids, no, and whenever we suffered with fever, cold, cough, or XYZ, any infection, generally children suffer with a lot of infections. So, what our father used to do was take us to a pediatrician. And when we went to the pediatrician, he used to prescribe us antibiotics, medicines, XYZ, whatever they prescribe. So, what happened was the fever would not come down in 2 to 3 days. And parents, especially Indian parents, they are worried. And then what happened was one of my uncle was a homeopathy doctor, and my father thought, why not just try homeopathy once for our children? So we went to him, and then the fever came down in just one day. And then the next time what happened was I suffered from a typhoid infection, and then again we directly went for homeopathy treatment. And this time what happened was typhoid subsided in just 2 days. I was somewhere around in 6th or 7th standard at that point of time. So my father was very happy. I was fascinated because I was just taking sweet pills, no injections, no tablets, no syrups, nothing. And in fact, it was curing much faster when compared to English medicine. So then what happened was I developed interest in homeopathy, that I should also be a homeopathy doctor. And my parents were also suffering from chronic illnesses, and they have also taken homeopathy during that point of time and got totally rid of their illness. And then when I came to completed my 12th, I joined a homeopathy medical college. So that is how I landed up into homeopathy. And what is homeopathy? So what, in short, generally we believe is, already the patient is suffering with some problem, with a big problem or a small problem. We do not want to make the patient suffer more. And that is the reason we choose sweet small pills to cure the patient. And homeopathy is a system of medicine which is based on a few principles, like how Ayurveda is based on few principles, Siddha is based on few principles. In the same way, homeopathy is also based on few principles. And the main principle of homeopathy is, it is holistic healing. Like, we consider the patient's disease, we consider the patient's mind, we consider the whole body of the patient, and only then prescribe the medicine. And what is more important is, our medicines do not have any kind of side effects. So without side effect, we cure both acute and chronic cases. So that
And
is homeopathy.
okay. And also, interestingly, you spoke about sweet pills. So, it goes contrary to the maxim that no pain, no gain. So, here there is gain even without pain. So, tell us about how homeopathy is different from other forms of medicine, such as allopathy.
So we spoke about infections, and then we've also spoken about how homeopathy totally cures chronic diseases. So first of all, let us understand what a disease is. In simple terms, when you read the word disease, 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 so it is a combination of two words, dis and ease. So the opposite of disease is ease. When a patient is at ease, what it means, he is healthy, both from mind and from body. So if a patient is having some condition, pathological condition in his body, he is suffering from a disease. And if he is having some disorder in his mind, it also means that he is suffering from a disease. Okay. And very importantly, we consider both the mind and the body. Now if a patient should be at ease, he should not suffer from his body nor from his mind. That is what is homeopathy, we believe. And that is the reason we consider both the mind symptoms and the body symptoms. Now, in English medicine, for example, if a patient is suffering from diabetes, There are 500 people who are suffering from diabetes, and they are taking treatment from one XYZ doctor. The mode of treatment is same, how the treatment has to go is same, everything is same for every patient. For example, they start with metformin, and all the 500 patients are given metformin. But in homeopathy it is not like that. And more importantly, what happens in allopathy, for example, a person is suffering from a liver disease, the doctor will only consider the symptoms and the signs and the investigations, only limited to the liver. He will not consider the other parts of the body. And every patient is hardly given 5 minutes or 10 minutes of time to diagnose. But what homeopathy here does is, now we took the example of diabetes. If I have 500 patients who are suffering from diabetes, the medicine given to each patient might be different. There are more than 1,000 medicines only for diabetes in homeopathy, and it changes from person to person. Now, how it changes from person to person? When the patient comes to us, we do not separate the body into spare parts like liver, kidney, heart, pancreas. We do not separate. We consider the patient as a whole. What we do is we consider the patient as a whole. And what we do is we start taking the case. And the process of case taking itself might range between 15 minutes to 2 hours to get the exact remedy which will treat the disease of the patient. So there are a few principles. Now what we do, we take the case in detail. We consider the patient from head to toe. We write down what all problems the patient has. After taking the case in the physical sphere, we go to the mental sphere with what problems the patient is suffering on the mental side. And then we look at the constitution of the patient, how the patient is lean, thin, tall, fat, dark, like that.
The
And
physical
then
attributes.
physical attributes. And then we have a look into the temperament of the patient. All this, it takes around half an hour, 45 minutes, 1 hour sometimes. And then we advise the investigations that are required for the patient. And then we prescribe. So for each patient, we take time to delve into the nature of the patient. We consider the disease of the patient, and then we also take into consideration how is his sleep, how is his appetite, what does he like eating, what does he dislike, whether he is comfortable in hot weather, cold weather, whether he feels very thirsty, does he have more amount of water or less amount of water, how are the symptoms of the patient. For example, if he is coming with a knee joint pain problem, are the symptoms aggravating in the morning or in the night, during sleep, in the winter, after passing stool. So there are multiple things that we consider, whereas other systems do not. And then after taking the case come the principles of homeopathy. So what is the basic principle of homeopathy? So what is the basic principle of homeopathy? As I've told in the beginning, that we treat the patient holistically. More importantly, we treat the patient and not the disease. So that is also a very important principle of homeopathy. And the system of administration of medicine, what we do is we have a principle called similia similibus curantur. So what does this mean is, let the like be cured by the likes. That is, a drug which produces symptoms in a healthy human being, those symptoms, if present in a patient who is suffering from a disease, will cure that patient. That is what we believe. So we have a process of drug proving. And then after proving the drugs, they've been proved for more than 200 years. We have a book called Materia Medica, which has a detailed description of the symptoms of each and every drug. We have more than 500 drugs, and we administer that particular remedy which best suits the patient, and that helps in curing the disease. Now some people have a question, that how can a drug which has disease producing symptoms in a healthy human being cure a patient who is suffering from similar kind of symptoms. That is what arises in people's mind. But see, even in modern medicine, for example, now when COVID was there, everybody had taken vaccines. And what do vaccines do? Now, for example, we have an Indian vaccine also, co-vaccine. So, vaccines will have either the dead virus or live attenuated virus, a weaker virus than the regular infection, or a dead virus, which might produce symptoms. You might have heard children who take vaccines suffer from fever, cold, cough, headache for 2 or 3 days, mild fever, cough, cold fever. Vaccine is given when the patient is healthy and the patient develops those symptoms. And in the same way, we have drugs which will produce symptoms and they are given to the patient who is suffering with the disease, and then the disease is cured with these medicines. And this has been going on for hundreds of years. So that is how we are different from allopathy.
So you spoke about healing the mind and the body of the patient, which is psychosomatic, if I am not wrong.
Psychosomatic, such terms like psychosomatic have originated recently,
Okay.
and now allopathic medicine, modern medicine are also giving importance to mental health.
Right.
They are also accepting that when mind is disturbed, the body is affected. That is stress. There are etiological factors for a disease in textbook of medicine, and in each and every chronic disease, if you go through the etiological factors, that is things which might cause the disease, stress is present in more than 90% of the diseases. Or sometimes they also write it as idiopathic cause, where there is no perfect cause for the patient to suffer from so and so disease, but we have been doing it for 200 years. You can call it psychosomatic. What we believe, every disease is psychosomatic. We've given names for diseases in today's world, but this has been done 200 years back by our founder, that symptoms are there in the mind, symptoms are there in the body. We need to correlate everything, talk to the patient, be humane towards the patient, and then prescribe the medicine. So yes, psychosomatic,
Is the right.
you can correlate it.
Okay. So you spoke about treating a patient based on their physical and mental symptoms. So if I come to you with a problem, of course, I'll have clarity on what my physical ailments are, or I mean, what are the pain points in my body, or where exactly the pain is. But how do you deal a patient based on his or her mental symptoms? And how will you know his psychological condition?
If the patient is not expressing his
Yes,
problems,
expressing his problem. Without expressing, how will you know? Because obviously, a patient themselves might not know what exactly is running in their body or in their mind. So how do you deal with it?
so I'll give it to you with an example of a case. A patient was suffering from rheumatoid arthritis. The patient was hardly 22 years old. So when she first came to my clinic, she was on a wheelchair. She had deformities in her bones. Like rheumatoid arthritis is a chronic condition. Arthritis, what does it mean? It means pain in the joints. So she had this condition. And rheumatoid arthritis is an autoimmune disorder. Now, what autoimmune disorder is that there are cells in the bones, and also there are cells which are fighting the foreign bodies entering our body, like the immune system of our body. Okay, so every patient has an immune system of his or hers, and these cells attack the joints. Autoimmune, these cells attack the joints and cause destruction in the patient. So this is a destructive disease, self-destructing disease. And the patient came to us, and as I've explained in the beginning, I've taken the case in detail, like how she's suffering, from when is she suffering, and from when has this suffering started. Also, we've considered the mental aspect of the patient. we've considered the physical aspect of the patient and also the temperament of the patient. So what we come to know is the patient was not ready to describe what pain and suffering was going on in her mind. This disease has started in the patient when she was 19 years old. Rheumatoid arthritis suddenly starts. The exact cause for rheumatoid arthritis is not known to medical science. And moreover, if a patient starts suffering from rheumatoid arthritis, what modern medicine tells is the patient has to suffer with it until death. There are life modifying drugs, there are painkillers which the patients use. So, this patient was not willing to share the agony, the pain that was going on in her mind. In such cases, what we do is, in general, what we do is, we consider the mental symptoms. Now, what we consider, from when are you suffering with this disease? Patient will say 4 years, 5 years. Did you have any tension during that point of time in life? That is what we ask. Some patients, they agree, they speak out. Like, yes, I had financial problems during that time. I had a troubled marriage. Now I'm out of that marriage. I had problems in school. I was being bullied in school. I was being bullied in college. I had a death of a family member, after which I started suffering. My father passed away 5 years back, after which I encountered with this problem. So this is what generally the patients say, and we also take into consideration these symptoms. But here, as a patient was not speaking, her temperament was like that. She didn't want to reveal much about herself. So we have a book of symptoms that is called the repertory. So in repertory, what do we do is, we take whatever the patient says. The symptoms of the patient are written in the repertory in alphabetical manner. And whatever the patient conveys, we take that symptom into consideration. So here the patient was very inexpressive. So that is like her temperament, like her constitution. And we take the same rubric, inexpressive, and we get a list of remedies. So that we take into consideration. Now this inexpressive remedy must also cover the symptoms of rheumatoid arthritis. That is how we take out information. Then what we consider the dreams of the patient. Dreams of the patient. Now what this lady had, she had a very peculiar dream. So what that dream was, whenever she used to wake up, in her dream itself, everything is happening. She's sleeping, she wakes up suddenly and finds herself in a sea, surrounded with tigers, lions, leopards. And after that, she jumps into the sea and she drowns. This was a repetitive dream that was occurring in this patient. So that we took into consideration. What we consider is rare, peculiar, and uncommon symptoms. Now,
Rare, peculiar, and uncommon symptoms.
Uncommon symptoms. So now this is rare, peculiar, and uncommon. This is going on in her subconscious mind. So that we take into consideration. We've also taken inexpressive symptom, which is a symptom for us. We take that also into consideration. And we take the list of symptoms which are troubling her body, that is her joints. When she is aggravated, when she is ameliorated, is hot application ameliorating the patient, cold application is ameliorating the patient, going out in open air is aggravating the patient. All this we take into consideration and we find drugs and then administer that to the patient. So that is how we take our cases.
Spoke about so a while ago you spoke about your founder. Could you tell us how your founder landed up discovering homeopathy?
Yes, so our founder, the great Samuel Hahnemann, he was a medical doctor of modern medicine. And during that point of time, what happened was, they were practicing medicine in such a way that it shouldn't be practiced. Like there were things like bloodletting. cutting off the veins so that the disease goes out from the body, is what they believed. And procedures like surgery were also there. And what our founder thought was, why suffer the patient more when the patient is already suffering? So what he did was, he left his medical practice, and coincidentally he was a linguist. He started translating books from one language to another language. What happened in this time phase was, he found a book called Cullen's Metromedica.
Woolen's Metromedica.
Cullen's Materia Medica.
Cullen's Materia Medica.
So when he found this book, he came across a drug called Cinchona, from which we derive quinine to treat fevers today. So what happened was, when he was going through the book, he saw that it was written that this drug has the ability to treat fevers because the bark of cinchona is bitter in taste. And then a sudden question struck his mind, that how can something bitter treat fever? So what he did was, he started consuming cinchona bark on a daily basis for a few days. Surprisingly, what happened was, after a few days, he himself suffered from a fever. And then he gave cinchona to patients who were suffering with fever, as he was a doctor. And fascinatingly, these patients recovered after being given cinchona. And then his thought probed him, like, how can something bitter treat fever, whereas it is producing similar symptoms in a healthy human being? He repeated this experiment in n number of people, healthy people and sick people. And then he came to a conclusion that a drug which is producing symptoms in a healthy human being can cure similar symptoms in a diseased patient.
Okay.
So that is how he came to a conclusion. So he discovered the law similia similibus curenter. That is how the basic one of the basic principles of homeopathy. And then what happened was, during proving this drug, now how drugs are proven in other systems of medicine, they are proved on animals. But here what is happening, they are proving it on healthy human beings. So what was happening, cinchona bark when given to a healthy patient is causing symptoms that might harm the patient. So then he came out with a theory of potentization, where we remove the harmful effects of that drug from that bark. Now cinchona bark is having the properties of treating fevers, but it is also giving out some side effects. So to remove those side effects, he developed the potentization method.
So could you explain to our viewers what exactly is potentization?
So what exactly is potentization is? Now we have a drug called aurum met. What is aurum met? It is aurum metallicum, that is gold. Now if you look at gold, you might think that there is no medical so what we do is, we potentize the drug. For example, gold, if we consider it as a drug over here, we take one part of gold,
Okay.
and then we add 99 parts of vehicle. That can be alcohol, distilled water, or sugar of milk. Sugar of milk is lactose, and we potentize it. There are methods of potentizing the drug. That becomes the mother tincture, the mother solution of that medicine. And then what we do is, we take one part of this medicine and add 99 parts of the vehicle, that can be alcohol or else distilled water. And again the process of potentization is done, and that becomes the first potency of the medicine. Now this becomes 1C. C is Roman 100. Okay. So that is first potency, 1C. You might have heard that medicines come with names Heparsulf 6C, Aconite 6C, 3X. 3X is 10. So in that case, what we do, 1 part of medicine, 9 parts of alcohol.
Okay.
If it is C, 1 part of medicine, 99 parts of alcohol. Like that we prepare 1C, 2C, 3C, 6C, 12C. Like that we go up to 1000C and 10,000C,
Which
1
is-
lakh C,
Which is 1M and 10M, right?
1M, 10M. 10M is 10,000. 1000 M is 1000
1000
in Romans.
In Romans.
And then there is CM, 100,000.
Okay.
And there is 1,000, that is mm. So we go up till there. So what happens is, when you put the drug under the microscope, you don't find the original substance. That is potentization. Now if you put aurum met 1M under a microscope, you will not find gold in the medicine, but the healing properties of gold are transmitted to the vehicle, and that is curing the patient. In fact, sometimes what happens is, after we give the medicine, the action is so rapid, the patient starts feeling better in 1 or 2 days with a disease which is suffering for almost 10 to 15 years.
Okay.
So that fast is homeopathy. And
So the rate of cure is accelerating after
Huh.
the intake of the medicine.
after potentizing the drug and then administering it to the patient.
Okay.
So this is what Samuel Hahnemann, our founder, also found.
Okay.
And then after potentizing, what he also found was he's removing of the harmful effects. Now there are medicines like cannabis indica, which we refer to as ganja, many people. So there are many medicines. So there are many symptoms in cannabis indica which are dangerous to the patient. And once you potentize the drug and then administer it to the patient will not have the harmful effects of the drug. Only the benefits which are there in the drug are only going to show effect on the body of the patient. Moreover, see here one more thing, this was about the discovery of homeopathy and how it all came out. What we also have to notice is, we have administered the drug which is in a potentized form, for example 1000C. Here the patient will not show any harmful effects in his body of the original drug substance. He is only having cure, and there is no side effect in homeopathy. That is the reason.
So talking of medicines, are pills the only form of medicine in homeopathy, or are there any other forms?
So we administer, like we prepare the medicine in alcohol, and then when the patient comes to us, we put it on the pills and then administer it to the patient. In the same manner, we use tablets. They are called as diskettes. So you might have seen, if you visited a homeopathy doctor, that sometimes they even prescribe tablets. Then also we have the direct mother tinctures. That is, before 1C we prepare the mother tincture, right? That is also administered to the patients many a times. Then we also have the alcohol, medicines prepared in alcohol. Sometimes, depending on the patient, we administer directly the alcohol, around 10 drops in the morning, 10 drops in the night, depending which vehicle suits the best for the patient, that we decide and prescribe.
Okay. Also, doctor, why surgery is not a part of homeopathic medicine treatment?
So, see, why surgery is not a part of homeopathy is, as I told, we treat the patient with potentized medicines, and what we believe, the dosage should also be minimum. It should be equivalent to very minute dose, which is not even visible under the microscope. And what we believe, it is a holistic system. We are giving the patient minimum dose of medicine. Minimum is almost equivalent to minimum. We are diluting the medicines up to infinity. So, and the patients are responding. Now, we have cases of total damage of knee joints, that is osteoarthritis. There are gradings in osteoarthritis where the cartilages have been damaged. There is total damage of the joint itself, and what the doctors say, you need to replace the joint, replace the existing joints with artificial ones. Now, this body has been given to us by God, and we are altering the state of the body. And what do we do for that? We perform surgeries, which also cause side effects on the patient. And that is the reason what our founder thought was there should not be any kind of side effects from our medicine. And that is why we only treat the patient with medicines and not with surgeries. First of all, what is cure? See, there are two things. One is relief, one is cure. If a patient is coming with the same osteoarthritis condition to my clinic, I am giving medicine. If I am a modern medicine practicing doctor, I'll be giving him painkillers, I'll be giving him life modifying drugs, and that will bring relief in the patient. Relief in the sense, osteoarthritis is not going out of the body of the patient. The symptoms of osteoarthritis are finding relief. That is relief. But cure is much more than that. What is cure? I, as a homeopathy doctor, prescribing homeopathy medicine, repairing the joint without the requirement of surgery, and again restore health. So, what is cure? Restoration of health is cure.
So that is where holistic healing comes into.
Holistic healing comes into picture, and we are treating a surgical case with a non-surgical process.
Non-surgical intervention.
Non-surgical intervention, and that is treating the patient. Totally. Curing the patient.
Curing the patient.
And not just giving relief.
Could you tell us about how homeopathy treats mental and psychological issues?
See, we discussed what disease is in the beginning of this episode. But disease is only one that can be present in any form inside the patient. We've given names to, we say there are various types of diseases, but disease is only one. The symptoms are appearing in different forms. The symptoms can appear in the body, the symptoms can also appear in the mind, the symptoms can appear in both. For example, body. Now, pain in the cervical region. It can be cervical spondylosis. It can be any other condition. So, a patient is having pain in the neck. Now, after diagnosing, we've given it a name as cervical spondylosis. Now, there are patients who also have insomnia.
Insomnia, which is sleeplessness.
Sleeplessness. So, here what is happening? Body is not being affected, but the mind is being affected. And we've named it as insomnia, as you've spoken about mental health. Now, also there are diseases which are psychosomatic. For example, IBS, where anxiety is involved, and whenever anxiety is triggered, the patient's digestion might be involved. The patient might have the desire to pass stool. So, we've taken three different examples: a mental health condition, a physical ailment condition, and a psychosomatic condition. Wherever, in whichever condition the patient comes to us, we take the total case in detail and then prescribe. If it is a physical disease, the patient will be cured. If it is a psychosomatic disease, the patient is cured. Even if a mental disease is there, the patient is cured totally.
But there's a but doctor, there's a criticism that homeopathy, the rate at which homeopathy acts is very slow. Why is it, and could you elaborate on that?
We'll take, for example, of diabetes. Okay, what happens in diabetes is maximum patients are suffering with type 2 diabetes. There are different types in diabetes, among which type 2 is one of the most prominent type. 95% of people suffering with diabetes are type 2 diabetic patients.
What exactly is type 2 diabetes?
So, what exactly is type 2 diabetes is? The glucose metabolism is disturbed, in short. Now, why it is disturbed? Because there is insulin which is produced in the body, and it helps in glucose metabolism. Now, what happens because of the lifestyle of the patient? the stress with which the patient is going through, this usage of insulin is disturbed. It is not stopped totally. The production of insulin is not totally stopped in the body of the patient. It is being produced, but either in a lesser quantity, or insulin resistance is being developed in the body. That is, the body is not realizing how to use the insulin produced. And then what he does, he starts taking medicines, or once the disease progresses, it keeps on progressing, he starts taking insulin also. So what the body realizes is, see, I'm already having sufficient insulin, I'm getting it from outside. So why does the body need to produce insulin anymore? So the insulin which is being produced also stops being produced in the body.
Okay.
And the patient has to take the medicines lifetime. So
Okay.
type 2 diabetes, where insulin was being produced but not utilized by the body, is converted into type 1 diabetes, where insulin is not at all produced in the body. So we are not curing the patient over here, but we are increasing the suffering of the patient. And the patient has to use the medicines for a lifetime. Likewise, many chronic diseases, psoriasis, rheumatoid arthritis, insomnia, all these, many people suffer with them for a lifetime, taking medications, life modifying drugs. But what homeopathy is doing is, now these are chronic diseases. We are treating the patients, reversing the diabetes in a span of 1 year, 1.5 years, 2 years. Here, the disease is totally going out of the body in a span of 1 year, 1.5 years. Now, this might look like a long period for many, but suffering with a disease for 1 year, 1.5 years is better, or suffering with a disease for a lifetime is better? You tell me.
Definitely for a shorter period.
So,
For a shorter period in the longer run.
Yes,
if I may
a
put it.
shorter period in the longer run, we are reversing the disease, making the patient healthy, restoring health in that patient, and the patient lives the rest of the life like that. So there are two types of diseases. One is acute disease, one is chronic disease. What are acute diseases? These diseases come suddenly like a storm, go away like a storm from our body, either curing or taking the patient away. That is, it might cause death also, like we've seen in COVID. It was an acute disease. The disease was staying for 7 days in the body of the patient, and then either taking the patient away or leaving the body of the patient. So in acute conditions, like I had discussed my own childhood, when I was treated with typhoid within 2 days with homeopathy medicines, that is much faster, right? In chronic cases, it takes time, but takes out the disease from the body, restoring health. So when it comes to acute diseases, many people might not have experienced homeopathy. That is the reason they feel that homeopathy is a bit slow. In chronic cases, they've experienced, but it takes time to remove a chronic disease. The disease which has been there in the body for 5 years, 20 years, 30 years will definitely take some time to come out of the body totally. And that is why there is a myth regarding homeopathy that it is slow.
Okay. Thank you, doctor.